Brazilian butt lift or buttock augmentation helps to change the shape, size, and contour of the buttocks. The demand for getting round, firm buttocks proportionate to the body shape has increased recently thanks to the popular celebrities. Yet, Brazilian butt lift has been the most controversial procedure. And why so? Because of certain risks associated with the traditional method of fat transfer to the buttocks, because of which many countries have also banned the procedure. And that is why we practice expansion vibration lipofilling, commonly called EVL, which is the safest method for Brazilian butt lift. Now, what is expansion vibration lipofilling? In EVL, first the fat is harvested in a sterile jar, mostly from the lower back and the abdomen, which creates a dual purpose of shaping the waist as well, creating an hourglass figure. This fat is then purified and sedimented. A tube is connected to this sterile jar from which the fat flows with the help of a pressure pump, resulting in smooth fat flow. Now this tube is attached to a 4 or 5 mm cannula, which is angled and it is basket shaped or flared. This cannula is attached to a power resistive device, which we at our center we use micro air. This power resistant system, it causes vibrations in the cannula, creating space in the subcutaneous plane in buttocks in multiple directions and multiple layers. This causes the expansion of the subcutaneous plane, creating more space for fat grafting in the subcutaneous plane itself, thus avoiding the need to inject fat into the muscle intramuscularly and its associated complications. As the space is expanded, the viability of fat cells also increases. Now, since the vibrations from this power resistive device, it causes expansion of the space available for fat filling. This procedure is called expansion vibration lipofilling. Expansion of the space with the use of vibration and fat filling. So why expansion vibration lipofilling or EVL is better? It has been seen that in cases of Brazilian butt lift, the injection volume is large. The amount of fat required ranges from somewhere around 400-450 cc to 1100 to 1200 cc of fat per side. This much of fat is required so that we can achieve a desired shape. The traditional method of injecting fat with syringe has several drawbacks when injecting such large quantities of fat. The first important difference is in the precision and the speed. Now, since the cannula size used in EVL is bigger, you have a better feel of the cannula with each stroke, with each pass, because we are constantly feeling with the non-dominant hand. This leads to precise placement of the fat in the subcutaneous plane. And because this fat is delivered faster using a pressure pump, the operating time is also reduced. Now with syringe, since the diameter of the cannula is smaller, we cannot always keep a track of where this cannula is going. And since we have to constantly inject fat in small aliquots, the time taken for the entire fat to be injected is quite more than EVL. Next important factor is the fat survival. The wider cannula along with the vibrations, they increase the space in which the fat cell is injected. This increases the fat viability. Now when we are using a smaller cannula, the fat has to be injected with more pressure, which leads to trauma to the fat cells. And that is why EVL has a better fat survival compared to the traditional syringe method. Another factor is the contour. The contour is smooth with EVL because the flow of fat from the pressure pump is smooth, and so there is even distribution of fat in the subcutaneous layer, and adhesions cannot form between the muscle and the skin, thus preventing contour irregularities. This is not possible with the syringe method because fat is injected without much space, and so there are more chances of creating contour irregularities. Another important difference is the surgeon fatigue, which translates to better results. Now, injection of fat using syringe, it requires repeated use of the hand muscles and force, and when it is such large quantity, it leads to surgeon fatigue. In expansion vibration lipofilling, This is achieved by the use of a power-resistant device along with the help of a pressure pump. And so the surgeon is working at full efficiency throughout the procedure, leading to better results. And last important difference, but the most important difference, is the safety. Most of the complications which have been seen after Brazilian butt lift has been reported after intramuscular injection of fat using syringe. Now, since sufficient space is created in the subcutaneous plane for fat transfer by EVL, injection into the intramuscular plane is not required. Also, since syringe is not used, accidental entry into the vessels is avoided, and that is why all these complications of intravascular injection of fat embolism is avoided. So, because of all of these reasons, expansion vibration lipofilling has been found to be the safest method for Brazilian butt lift. And we have incorporated this method in our practice for all our patients desiring Brazilian butt lift to give them the safety as well as the best results. Thank you.